living measures. And the Minister for Health, Jennifer Carroll McNeill, will address delegates, and the Minister joins me on the line. Minister, good morning and welcome to LMFM.
Good morning.
Let's firstly talk about the most recent figures from the Irish Nurses and Midwives organisation, which showed that last month was the worst April for overcrowding in Irish hospitals in the 20 years since the INMO began counting patients. That is a dreadful statistic to hear after all this time.
Well, we actually have reduced our trolley numbers and our overcrowding very significantly over the past year. I think it's fair to say in the first quarter of this year, notwithstanding real efforts to reduce that, we've seen huge increase in presentations as well. Our demand is up very significantly. But we work on this all of the time together to make sure that people are not stuck in emergency rooms. And those numbers have come down very, very considerably year on year. So it's particularly in Drogheda, who have had a complete turnaround over the last 16 months in terms of the experience in their emergency room, which had been, as you will know and as your listeners will know, 18 months ago would have been consistently challenged all the time in red, whereas now they're managing it really well. And where there's an event, where there's a day where it's overcrowded is much, much more the exception than the norm, and they recover very, very quickly. As a whole hospital, when it does become overcrowded on a Monday morning or otherwise, it's a totally different experience in Drogheda, and that's down to the work of the people there, the nurses and midwives there, the doctors, the consultants, and the way in which the hospital management has embraced working differently, working more at the weekends, rostering people differently, and making sure that it's totally patient focused, which is a big change over the last 18 months.
Okay, but the INMO are arguing that we're facing a national crisis, and they say that levels of stress, burnout and unsafe conditions reported by nurses in the last month, for example, 61% said they considered quitting in that time. That's an indictment, if ever I heard one.
I think the INMO are there to represent their workers. There's no question but that people who are in overcrowded emergency departments are going to feel pressure, and I don't want them to feel that, which is why we have put an emphasis on the whole of hospital, making sure that the emergency department isn't under pressure. What does that mean? It means that unless you're discharging people in other parts of the hospital on Saturdays and Sundays and right throughout the week, unless you're doing diagnostics right around the clock and not just from 9 to 5, unless you're doing that, the emergency department will become overcrowded. And many of the people whom I've heard from are experiencing that pressure in overcrowded emergency departments. That's why I've placed such emphasis on reducing that pressure in urgent and emergency care, on making sure that we have pathways to help people avoid hospital where they don't need to be there. We particularly have put a lot of emphasis into what's called ICPOP teams, which are teams to support an older population in particular, to help them avoid hospital through frailty, through falls and other avoidable admissions. And that's why you've seen that emphasis from me over the last number of months, to support patients and to support staff and to support the working environment within where they turn up with total commitment every day. It takes a whole hospital to look after an emergency department, and for too long, too many emergency departments were isolated because there wasn't that whole of hospital emphasis. That is really changing, and I have to say, of all of the places where I've seen the greatest level of change, Drogheda has to be leading among them.
Okay, but one of the issues that we've actually dealt with in the emergency department in Drogheda, for example, and has been highlighted on this programme on a number of occasions, is security. And an awful lot of nurses in this INMO survey feel under a major pressure. They highlight security issues, being threatened while in work and so on. What can be done in order to make nursing staff feel safer doing their job?
Well, I mean, the first and most obvious thing is that nobody should think that they can commit an assault or commit an attack on any person, and especially not somebody working in a hospital providing a service to the public. I think the overwhelming number of people listening, your listeners, wouldn't ever consider attacking or hurting any person in a hospital. You wouldn't do it. I wouldn't do it. It's absolutely, completely and totally unacceptable. And nurses need to be safe. Everybody needs to be safe. But in particular, nurses who are providing care when people are at their most vulnerable need to feel safe, and that's hugely important to me. And it's so every instance where that happens is distressing to us all. Now, I will say that from the incident, the number of assaults have reduced very, very considerably. But every instance of any attack on a frontline worker is an assault to the whole society, and it's completely wrong.
Okay, so when you meet the INMO at their conference today, you're going to hear from a lot about burnout being a daily concern, that nursing staff feel under constant stress, under constant pressure. And in fact, the INMO General Secretary Finlay Hay said the level of stress is not something anyone can or should live with in the long term. How are you going to address that?
Well, the first thing is we're going to continue to recruit frontline workers, frontline nurses. The number of nurses has increased by 30%. It's a huge increase, nearly 11,000 additional nurses in the last 5 years. That is hugely important to us. We're also increasing the number of other frontline healthcare workers, health and social care professionals to support nurses. We're giving nurses the opportunity to work at much higher levels in their profession, advanced nurse practitioners, really leading care. We're giving different ways of working through virtual care, where nurses can lead the delivery of care and take pressures off hospitals in different ways. We're doing everything we can to invest in frontline service delivery, to support patients, to support the people of Louth listening to this morning, and Meath listening to this morning, and to support staff. Those two things go absolutely hand in hand, and that's why we're continuing to invest in staff and make sure that we're recruiting more and more people to work on the front line. That's
okay, but Finlay Hay also said, Minister, Finlay Hay also said that lack of protections for staff while they're actually on the job is worrying, and she has called on the HSE to stop ignoring staffing policies. Are you going to be able to reassure nurses today that more will be done to protect them while they're working?
But that is what we're doing, and we are implementing together with all of the staff a safe staffing framework, a safe nurse staffing framework right across the services, and we're doing that very much in partnership, and that's being rolled out. That's nearly complete right across the hospital structures, and so we're already doing that together. It's really important that we have safe staffing levels. We're achieving that through the implementation of a range of different technical solutions to be able to monitor who's where, who's rostered where, and what's the need, what's the ratio of staff to patients, and how do we make sure that we will in the future license the ability of people to run healthcare services based on having that safe staffing mix. So that's something that we're working on, is already in place and is already being rolled out and augmented in certain areas where it hasn't been fully done, but that's very much a partnership approach. So these are things that we work on very much in partnership together. We're trying to achieve the same thing, which is delivery for patients when they need it, and a safe and secure working environment for staff. So much of that is dependent on the reforms that we're trying to bring in right across the board, to have consultants and doctors working over 6 days and 7 days, where it used to be the case where they were rostered over 5 days. Nurses well know that they're working 6 and 7 days a week. It has to be more balanced throughout the whole hospital complement of staff, and all working together to support each other. So we really are working on this reform agenda. You can see that in Drogheda, they have embraced this. They are working at it at a faster pace than many of the other hospitals, and it has totally changed the environment in the emergency department. Not to say that they don't have a couple of bad days here and there. Everybody does, but it used to be the norm, and now it isn't. And that's a totally transformed experience for people working in that hospital. It's a transformed experience for patients in that hospital. And I commend all of the people working there in the management for the effort that they've made to try to shift something that was really very, very, very persistently negative to something that's really quite different, and in such a short period.
Okay, now separately and unrelated to your visit to the INMO conference today, a scoping exercise we know is underway into convicted sex offender and former Louth hospital consultant Michael Shine. You said in the Dáil the other day, Minister, that you believe that the total number of those impacted is believed to be in the high hundreds and ranges across a huge age span.
I do believe that. I believe that because that is what the victims and survivors have told me. And I have listened to them, and I have listened to the many men of different ages. I have listened to men who have come through Dignity4Patients, who are working with Dignity4Patients alongside them. I've listened to men who have contacted me in other ways. I've listened to public representatives who speak on behalf of people whom they know, who have been, hurt and betrayed by the paedophile Michael Shine, that he is and was. And I really listened. I really heard. I heard the gaps in how the state responded subsequent to these revelations coming out in 1995, the investigations and inquiries that happened, what they did and didn't do. And I really do believe there's a necessity to find an appropriate way to give voice to those who want to have their voice heard, to find ways to investigate what we can within the state structure. And that's why we've put together this scoping exercise that is working with Dignity4Patients, working with advocates, Mr. Lorcan Stain, Senior Counsel, who has decades of experience in criminal law, in restorative justice, in supporting victims, and he's working with Maeve Lewis from the former CEO of 1 and 4 to make sure that we have a really trauma-informed, victim-centred process that supports people, because this will be difficult for many, obviously, and we want to make sure that we try and approach it, even this, in the best way that we can, to try to support people through every stage of this process. But yes, I am I have such respect for the men that I've spoken to and those who have experienced this and who haven't, spoken, and they don't need to necessarily, but we are aware that they are there. So many men who haven't said anything. I am aware that they are there. I am aware of what they've experienced. And I suppose what we're trying to do is find the best way of giving voice to those who want to have that voice in a respectful way, in a serious way, in an impactful way, and try to construct the best mechanism for that. And that's why we have this scoping exercise going on.
And the scoping exercise will ultimately, or could ultimately lead to a full inquiry. Is that right?
Yeah, and there's different types of inquiries. We have to try and find the right model that's going to make sure that we can get the best access to the information that I know victims want, that's going to give voice, and that's going to be able to do that. And we're really working with Dignity4Patients to try to, and the independent facilitator, I should say, I've asked there to be a measure of independence from me and from the Department of Health, because of course the Department of, the health system was involved in this. So I've asked the independent facilitator to really think about what's available, what's needed, and how would we get to that point about an appropriate inquiry for the future. I don't want to preempt their work. I don't want to step across that, but let me just say that we're supporting Dignity4Patients for their engagement with this. I really do believe it's been, I hope that other people believe it's been a really collaborative process, that we're there to try to provide support at every stage, and that we are taking these different steps because I have heard the voices of the men that have come to me, because I have heard through their public representatives what has happened and how they have felt for so long. And because, I have to say, because of the sheer scale of this as well, not that any instance of sexual abuse is okay or appropriate. Of course it is not, but we also have to recognise the societal impact of something that was so much at scale, so prolific, and the number, as you've said, the many hundreds of men who have been impacted over such a long range of time. And it's something that sat with me very deeply, that struck me very deeply, and to the extent that I can provide support to those men for the future by taking these steps, I think that's an appropriate course of action.
And just finally, Minister, before I let you go, earlier in the week, on Tuesday, in fact, we spoke on this programme to a lady called Amy Burns, and it's not the first time we have spoken to her. We've spoken to her many times, and Amy Burns lives with endometriosis. She's now completely housebound as a result of how debilitating her endometriosis is. And the question that I wanted to ask you is, this lady was in tears on this radio programme on Tuesday because the care that she needs is not being provided. Endometriosis is something that we've spoken about at length for years in this country, and still we have somebody like Amy Burns who's just inconsolable in terms of how her health is. What do you say to somebody like her?
Well, I've spoken to many people, many patients in the Department of Health. I've had 2 patient voice forums precisely to bring those voices directly into the centre of the Department of Health, with the CEO of the HSE, the Chief Medical Officer, everybody listening to those women, to their experience and how the health system hasn't met their needs and very, very far from it. And we have made on foot of their voices important improvements to how we're treating endometriosis. We have a long way to go, I may say. We have a long way to go in terms of how we train surgeons and the type of surgeries that are available here. We have a long way to go in terms of how we manage pain. But things that we have managed to take steps forward on, whereas I demanded, really, I'm sorry to say, an extra 100 surgeries be done in the fourth quarter of 2025. We got 142 extra surgeries beyond what was planned. We have introduced a new education system through MISHA, which is 2 really fabulous endometriosis advocates, who are going around schools and workplaces, really changing the dynamic and the narrative around endometriosis, that people understand that if they don't suffer from it, that they understand the degree of pain and the debilitating pain that women are going through, and what that means.
If I can, I just want to play just a little bit of what Amy said on this programme the other day, and I want to just get your response to it if I can. Just have a listen to this, please. What do you want to say to Jennifer Carroll McNeil if she listens to this interview?
I want to say, if it was your daughter, would you leave her the way that I am? Because she wouldn't. And if it was her, would she accept that it was 6 months' time and I have no life for her children? Anyone that knows me knows that I am a really, really positive person, and it's really hard to be positive when this is beating you down every single day, and you're trying your best every single day, and you're watching your family try their best every single day to keep it together for you, but they can see that I'm not getting any better and that I'm not okay, and my son has to watch this.
Do you want to specifically address that, Minister?
Well, I mean, Amy's experiences, I've spoken, with Amy and many others who have had this experience of being let down by the health system, who haven't had the surgery that they needed and who are in ongoing pain and discomfort. And I'm very aware of it, which is why we've placed all of this emphasis on endometriosis. When, for example, I was on my St. Patrick's Day trip, I deliberately constructed my meetings around visiting a specialist centre of endometriosis in Berlin to see how we can learn from and partner with them better. We have the European presidency of the presidency of the Health Council, the European presidency in the second half of this year. I have deliberately put endometriosis as a front part of that, so that we're having this conversation at a European level. I've taken every step I can to try to drive more awareness so that people understand what Amy is going through in the workplace, what Amy's going through in families, and people like Amy. Let me not be disrespectful to her, too specific to her. We've tried what we're doing in terms of improving access to surgery within Ireland, access to the type of surgery that people need, that women need, improving access to surgeries internationally and paying for those surgeries where women had to pay for them up front and then we'd reimburse them, trying to take a different approach to pay for them up front. We're trying to train radiologists on better imaging, because endometriosis can be really difficult to see some types of it, and we haven't been seeing it and meeting that need for women early enough. We're trying to substantially improve our pain management, because while for some women with non-complex endometriosis, regular pain management might be fine, for other women, it's not fine, and we're not meeting their needs, and we don't have the complexity of pain management support for those women. We have to understand we're recruiting additional surgeons. Like I've put provision in for an additional 60 people. It's 149% increase for people, surgeons, clinical staff working in endometriosis, to try to make sure that we have the capacity that we're going to need. We've set up training fellowships for our surgeons. We have people travelling now to shadow and watch surgeons abroad to get better and better techniques. So at every level, we're trying to improve awareness, we're trying to improve treatment, we're trying to improve pain management, we're trying to improve every aspect that we can, so that women like Amy and many others like her don't have to experience this. But what more than anything else, so many women have been experiencing this in essentially silence for years. You've been talking about this, but not everybody else has. And it's not well enough understood in workplaces. It's not well enough understood even in the health system. And I am trying to drive awareness. And I think over the last number of months, we've made some difference in that. And I'm trying to use every tool that I can, every lever that I can, like for example, the College of Physicians, which holds a spring conference every year. I asked them, I said, do this on endometriosis. I am asking you to do this on endometriosis, and they did, which gives it greater visibility among clinicians and really says, look, this is important in the clinical community. So we're every lever that we can, we are trying to drive awareness, drive improvements, so that we can support Amy and many, many others like her who have needed much better support for a very long time.
Minister for Health Jennifer Carroll McNeill in Louth today for the INMO conference. Minister, thanks very much indeed for talking to us here on LMFM.